Okay, thank you again for joining us for our Systems for Action Research and Progress webinar series. My name is Carrington Lott, and I am the Deputy Director at Systems for Action. And if you're not familiar with Systems for Action, we're a national research program office of the Robert Wood Johnson Foundation. We have been operating as National Program Office since 2015, and one of our main roles here at Systems for Action is to develop and release annual funding opportunities, soliciting innovative ideas of ways to align the medical, public health, and social service sectors in a way that improves health equity. And more recently, a focus is on how we can align these systems in a way that dismantles systemic racism that has been embedded within each one of these systems. So this is a series that we host as a program office, the Research and Progress webinar series, where we typically ask research teams to come and present on their Systems for Action research multiple times throughout their project so that you get to learn what they're learning sort of in rapid real time. You get to learn alongside them. And we are doing a special series where we're promoting and offering the space up to grantees through the System Alignment Innovation Hub. So the System Alignment Innovation Hub is our partner program that aims to support community-based organizations that are interested in engaging in research, specifically system alignment research. So they do many different activities to support community-based organizations. They offer space for CBOs across the country. They come together and talk about what they're doing, what barriers they're experiencing, and they also fund their own research through their own mechanisms. One of those being the equity capacity building grant process. And this is the first time that they've done this. They recently awarded 12 different groups an equity capacity building grant. And they did this using a trust-based philanthropy model. And these groups are doing great work. And so we wanted to make sure that we reserve space in our Research and Progress webinar series to highlight what they're working on and what they're doing and give you an opportunity to hear about that great work that they're doing. So today we have a group from the Lives in Progress Collective and National Leadership Consortium presenting to you on their work. The title of today's presentation is, as you can see on the screen, Reimagining Equity and Autonomy and Disability Justice. And they have some great things to share with you. So I'm personally looking forward to it. And I know that they have some great stuff to cover today. Monica, do you mind going to the next slide, please? Thank you. So a few things before handing it over to the team, just some housekeeping items. We're here in the welcome, and then you'll get to hear directly from the team on what they're working on. So you'll get to hear from DJ Savarese and Monica Mesa-Alvarez. And then at the end of that presentation, we'll save some time for Q&A. So if you have any questions at any point during today's session, just locate the box at the bottom of your Zoom screen, enter your question in, and we'll make sure that we save time at the end of today's session to address those. In addition, we are also recording today's session, so we'll make sure to send out the recording as well as today's slides after the session. And I think that's it for housekeeping. If you have any questions or comments, you're free to put them in the chat, and we're looking forward to seeing your questions. So DJ, I believe you're presenting first. I'm going to go ahead and hand it over to you, but thank you all for joining.
Hi, everyone. Thanks for joining us today. I'm DJ Savarese. I'm a young white male with glasses, a goatee, and short, wavy, reddish-brown hair, and I'm wearing a charcoal gray, short-sleeved shirt with a series of cement steps cascading behind me. In addition to being the founder and facilitator of the Lives in Progress Collective and co-chairing the Alliance, I'm a social entrepreneur, artful activist, filmmaker, multi-genre writer, presenter, teacher, and public scholar who believes leaders support others in their shared goals in the face of uncertainty. Next slide, please.
Hello, everybody. My name is Monica Mesa-Alvarez. My pronouns are they, them. I'm a Latinx person wearing brown light tinted glasses with a blue and white striped shirt and dark uh, hair. And my background today is the National Leadership Consortium's background with its logo and my name and title. I am a research and development associate with the National Leadership Consortium. Um, the work that I do at the consortium focuses in advancing equity and human rights in disability services through organizational policy alignment, leadership development, and participatory research. I'm also a PhD candidate in public policy and administration at the University of Delaware, where I'm conducting my dissertation research trying to understand how organizations operationalize emancipatory disability policy and person-led practices.
Monica, is this slide for DJ?
Yes.
Okay, DJ cannot see the screen right now. So, DJ, I'm wondering if at the top of your Zoom screen, do you see there's two different tabs, one that says webinar and one that says Monica Mesa-Alvarez's screen? I'm wondering if you click on the one that says Monica's screen, if you're able to see the slides.
Yes, thank you.
Perfect. Thank you.
We all have the capacity to make the world a better place. We all yearn to be an essential part of something bigger than ourselves. And yet most disabled adults are forced to live segregated, impoverished lives absent of the security, freedom, community, health and agency that all human beings deserve, namely self-direction. 35 years after the passage of the ADA, only 2% of us are self-directing our lives. And those 2% are threatened by cuts to Medicaid and Med-waiver programs. This allows society to view self-direction as an exception, not a human right. Most of us are forced to live lives of convenience for other, non-disabled people. The life outcomes of people with disabilities are funds and systems driven and parented or agency controlled, and even those who claim to be person-centered don't consider our opinions. They aren't collaborating with the disability community and often don't personally know any people with disabilities. Those of us who do direct their own lives are seen as exceptions instead of part of an expanding collective of disabled leaders who are engaged in meaningful lives within their local communities. Next slide, please. The Lives in Progress Collective at the Alliance for Citizen-Directed Supports, LIPC, addresses an unmet and urgent need to help adults with disabilities become essential members of their local communities, build a diverse national cross-disability community, and become the leaders in defining what is possible in our own lives. LIPC is disability-led, with an emphasis placed on the multiply marginalized and or alternatively communicating. 64% of our working board members are long-standing, well-connected, respected cross-disability leaders, who support others in their shared goals in the face of uncertainty, and the other 36% are fresh-thinking allies and professionals who work for meaningful engagement for all. Next slide, please. Founded on Zen's Invalid's 10 Principles of Disability Justice, our SAIH-funded project. 1. Foregrounds the most marginalized within the disability community, namely the multiply marginalized and alternatively communicating, i.e. non-vocal cord speakers. 2. Erases any delineation between people who are privately and publicly funded. 3. Models what's possible in a world where the disabled lead and others offer the assistance we request. 4. Practices, promotes, and foregrounds interdependence, over independence and self-efficacy, or the belief one can make positive change over self-reliance. 5. Works collectively to resist exceptionalism and being siloed, uses rhizomes as our model for growth, sustainability, and community building. Rhizomes persevere by creating an intricate network of multiple root bulbs full of nutrients and resources that grow both vertically and laterally. If cut down, they grow back. Faced with adverse conditions, they can lie dormant underground for up to a year, rejuvenating themselves before blossoming again. In this sense, weeding them out is far more difficult, if not impossible, and rhizomes embody a diverse range of plants. 6. Works intersectionally, with the understanding that a Black, gay, poor, blind woman faces exponentially more oppression than a white AC-using, cisgender male such as myself. Next slide, please. We also share the belief that in order to transform the world we live in, people with disabilities need to ask, and not just answer, the questions. With that in mind, here are the questions that guide all facets of our work. While these questions guide the mission of LIPC, they're also good research questions. 1. How can we support others in their shared goals in the face of uncertainty? 2. How can we ensure every single person who accesses LIPC will encounter disabled leaders, mentors, and role models with whom they identify? 3. How can we conduct meetings in a way that honors and respects the time and energy commitment of multiply marginalized, disabled advisors? 4. How can we nurture interdependent, change-making relationships instead of independence and self-reliance? 5. How can we create a fluid, dynamic, centralized resource that amplifies, and doesn't erase, valuable grassroots efforts? Next slide, please.
All right, so I first of all I want to say thank you to DJ for inviting us to participate in this project. And today it is my honor to be representing the National Leadership Consortium on Developmental Disabilities. We are we were founded in 2006 in order to continue the momentum of the institutionalization and inclusion efforts that have been happening in services and supports for people with disabilities for a few decades before. And it was funded by Nancy Wise and Stephen Eidelman, two of the great leaders in the disability fields that lead the institutionalization in the United States, but also around the world. And we do several projects. We do programming, but we also do research. In our research, we collaborate in research programs and programs that acknowledge multiple forms of discrimination while contributing to their unique perspectives to influence how services can better support people with intersecting identities. Today, I'm speaking on behalf of our team, but you can see here in the picture to the right, this is our small team, co-director Dr. Katie Bailey, co-director Kristen Lomis, research and evaluation manager Dr. Corey Gilden, myself, and our program coordinator Nicole Jones. So we're very thankful for this opportunity and looking forward to continuing collaborating with DJ in advancing human rights for people with disabilities in the field. No, they're just going to talk over.
LIPC and NLCDD have an authentic, established, reciprocal partnership. One of the leaders of the NLCDD was a founder of the Alliance, which hosts LIPC. The Alliance is one of NLC's 19 national partners. Many of our board members are faculty for various NLCDD programs, and LCDV is obviously currently contracted with LIPC to support the research and evaluation efforts of LIPC's SAIH Equity Capacity Building Grant, and we are continuing to collaborate on future proposals and opportunities. Next slide, please. Our shared goals for the SAIH Equity Capacity Building Grant are the following. 1. To locate, access, and amplify more and more voices of disabled people from historically marginalized communities. 2. To offer 2 free 4 to 8-week learning communities led by and for BIPOC with disabilities. 3. Innovate ways to sync LIPC tools and processes with the current adult services, education, and health systems, including waiver programs ostensibly devoted to self-direction. And 4. Identify more key partners in medical, public health, and social services for future disability-led systems alignment research than those we already have. Next slide, please.
All right, we'd like to start the research presentation talking a little bit about what's our theory change with this project. So we envision, as you can see in this theory of change big chart, we envision if we do strategies that are intended to improve capacity building, cross-system collaboration, peer mentorship, and also wellness and support. We see we have the goals of advance increased availability and participation of um, people with disabilities that belong to historically marginalized and underserved communities like Black, Brown, and Indigenous people. And we see as intermediate objectives some changes like improving understanding of how to promote cross-system alignment, improving understanding of structural racism, ableism, and cross-system misalignment, and increase cultural responsiveness from participants and increased service accessibility, which would lead to co-created and equity-driven practices and protocols that definitely will increase, or we hope, that they would increase autonomy, self-determination, self-direction, and inclusion for Brown, Black, and Indigenous peoples with disabilities. Our long-term goals is make us contribute to more aligned, equitable, social, medical, and public health service systems, but all impacting how we improve health autonomy and social determinants of health for Brown, Black, Indigenous people with disabilities, and in making sure that human rights are upheld and inclusion and self-determination is maintained throughout. And now in the next slide, Diya's gonna talk a little bit about how we think that we could do that.
What we are trying to do with this $40,000 grant is learn as much as we possibly can, so we're able to offer future funders of our systems alignment pilot-specific methods based on the lived experiences of an even broader group of disabled BBI leaders. What we know is this: who asks the questions matters. If we're simply answering others' questions, we're often stuck reinforcing the status quo. Second, we needed to throw away certain tools and tables to enable our BBI research assistants to get at what matters most to them. Third, rather than ask them to create evaluative questions for a curriculum that was already developed, we wanted their research questions to shape and amend the curriculum we're developing for use. And finally, we added an extra meeting devoted solely to the how of what the evaluators and researchers should do, something we will talk more about shortly. We care deeply about this aspect of our research process and think it's something that's often missing in innovative or transformative research. Next slide, please. This grant funding comes with a tight timeline. So collectively we 6 disabled LIPC board advisors tapped our active connections with over 60 organizations to identify and choose our 15 BBI research assistants. Without exception, they accepted the position and committed wholeheartedly to the work at hand. A development we think is indicative of how rare, or non-existent, funding can be for such projects, even among disability-focused grantors. We anticipate their full engagement and leadership with every aspect of the research progress, development, execution, analysis, and dissemination. Next slide, please.
Okay, but who was recruited to participate as research assistants in terms of demographics and social composition? Well, the Lives in Progress Collective Research Assistants exemplify the collective's core commitment to cross-disability, intersectional, and community-rooted leadership. So you can see here that the team's demographic profiles reveal both diversity, but also alignment with LIPC missions to elevate voices from multiple marginalized communities. When we look closely at age, you can see like most participants range from 25 to 64 years old, with most falling between 35 and 44 years, which is an age group that often is positioned in the intersection of emerging and experience in life experience, which definitely contributed to our research meetings. Gender identity and sexual orientation, you see here, like across the group is diverse. Most identify as male or men, following by women or cis women. And a smaller group said they were non-binary or gender diverse. And sexual orientation spans a spectrum here too. So though the majority identifies heterosexual, with several identifying as queer, pansexual, or asexual. This range reflects LIPC's intentional inclusion of individuals who experience also gender and sexuality beyond traditional categories and embodying the intersectional framework that we want to explore and all the lived experience of marginalization, of discrimination and marginalization that we wanted to understand. Racial, ethnicity, and indigenous identity, you guys can see again, like the research assistants were racially diverse, with most of them identifying as Black or African American, and following by Latin people and South American Indigenous, also Middle Eastern and North African, South Asian, and Korean American. Two participants explicitly identified as Indigenous from Wayuu and Mexican, Latin, and Indigenous. Definitely contributing to perspectives that connected disability advocacy and Indigenous cultural frameworks. You can see that this composition shows that our recruitment was successful, centering voices from historically marginalized racial and cultural communities. And we try to ensure representation in this from this community in our research. When it comes to communication method and accessibility, most of our research assistants said that they use spoken or written English as their primary communication methods, while others communicate through multilingual approaches, sign language, or augmentative and alternative communication AAC systems. This diversity in communication also reflects our commitment to language justice and access. And we try to ensure that people who communicate through a variety of modality are fully contributed to this research process. For education and geography, The level range from high school diplomas to graduate and professional degrees. And geographically, our participants were distributed across 6 states and Washington, D.C. The majority lived in urban or suburban areas, reflecting engagement with community-based and metropolitan service systems, where we know that disability advocacy and self-directions are often more active. There are some limitations. We did not were able to recruit anyone from rural areas, at least those that participate and disclose their demographics. There were 16 research assistants, and future efforts for extending this research should target this outreach and like trying to recruit rural participants and expand recruitment across additional geographic and cultural contexts. Okay, but how did the research meetings happen? Well, first of all, we have 4 research meetings, and we follow a participatory, multi-phase qualitative design grounded in disability justice, cultural humility, and systems change theory. This project it's from development. It's guided by the principle of co-creation, where people with lived experience, they are the ones that have the you know the lead in co-creating everything from the research questions to the curriculum to the evaluation, conducting it, particularly those from Black and Brown and Indigenous communities. They worked, we, the researchers, worked alongside them to define the protocol, to shape the tools, and also to interpreting the findings. Today, we're going to talk about phase 1, which is the instrument development. And in this first phase, the theme, our research team at the National Chip Consortium co-design measurement tools in collaboration with people who have this lived experience with racism, ableism, and systems navigation. This participatory process ensured that the instruments were not only culturally grounded, but also accessible and contextually relevant, strengthening the rigor, but also the inclusivity of the study. Okay, what we found? We found 4 major constructs or 4 main themes that emerged from our meetings across the group discussions. Like the word is interrelated, we know, but we try to categorize them into meaningful community engagement, defining what's possible in your own life, wellness, and authentic relationships or friendships. This capture how participants experience and define inclusion, self-determination, and interdependence in their daily lives. Collectively, these 4 themes can illustrate the ongoing tension between our research assistants' aspirations for agency and belonging, and also they reveal the structural and attitudinal barriers that limit their full participation. All right, but for meaningful community engagement, you see participants like our research assistants emphasize that true community inclusion involves both access and belonging, being seen and valued in disability and non-disability spaces alike. Support center around opportunities for participation and community events, reciprocal mentorship, and representation through disability justice lens. As you can see here, one of our research assistants said, providing access to different opportunities within my community, getting me included in musical spaces. However, some of them also talked about persistent barriers, like accessibility and attitudinal barriers, including that still events that remain physically and socially unwelcoming, lack of transportation, and community spaces that fail to incorporate the disabilities justice perspective. One of our participants said, Being part of my community means that I can go to concerts and I don't have to leave. And this film definitely underscores that inclusion is not merely about presence, but about comfort, continuity, and respect. When it comes to the concept of defining what's possible in your own life, it reflects our research assistants' emphasis on self-determination, voice, and possibility. They talked about the ability to define one's path while accessing support that honors autonomy. For them, some of the facilitators included choice-making tools, AAC and mobility devices, helpers, and self-director services. Uh, One quote from a research assistant reveals that I have to speak to myself and say, even though people may not listen to me the first time, it's possible for me to get it done by any means necessary. Some of the barriers related to these constructs were around medical paternalistic approaches, misidentification, and system biases that definitely undermine personal autonomy. Several other of our research assistants describe experiences of being spoken over or disregarded in healthcare systems, reinforcing the importance of respectful communication and the recognition that people with disabilities have the authority on their own lives. This 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 reflects Lives in Progress Collective guiding belief that freedom and possibility emerge from interdependence, not isolation. In regards of wellness, uh, our um, our participants, our research assistant talk about wellness as a holistic and interconnected, encompassing physical but also spiritual and emotional well-being. One of them said that wellness for them was relying on God and spirituality that helped me survive after my stroke. Barriers still persist, like barriers like racism, ableism, rush appointments, and sensory overload in healthcare environment. Two of them share that, for example, just allowing myself to take time, not feel like I have to rush around. And then another participant said, sometimes doctors don't listen to me. They go to the nurses instead. You can see these findings affirm that wellness cannot be achieved without both cultural humility and relational care within all the systems altogether. And finally, authentic relationships and friendships. For our research participants, they were consistently describing as central for them that they have to have a sense of belonging and self-worth. Authenticity, that it was defined as trust, honesty, respect, reciprocity, and also listening. These are qualities that enable shared growth and emotional safety. Also, although some barriers like tokenism, manipulation, and transactional interactions could at all mutual respect and reinforce feelings in isolation. And according to one of our research assistants, having people actually listening to our voices and stories instead of seeing us as tools of inspiration to be included, fully included. These findings represent the social conditions for dignity and visibility in a society that often objectifies and sidelines disabled people. But let's see how we are gonna do this.
Certainly, systems manage us, so simply better aligning those systems to manage us more efficiently is not our goal. We all need to realize that simply including the people with lived experience who are most impacted by the issues research addresses is not enough. We need to also change the tools and processes we use to ensure they're offering new ways forward and not imposing cultural norms we're actively seeking to disrupt. What we need to do is alter our surveys, interviews, analysis, and dissemination processes to ensure we're honoring the well-being, cultures, and values of those whom our interventions and research are proposing to help in creating trustworthy, inviting spaces in which participants can speak their minds. Next slide.
And how we're gonna design inclusive protocols. Like DJ was mentioning at the beginning, the last meeting was specifically trying to get feedback from the research assistant on how we ask the questions, how this question has to be, and how the interviews or the focus group have to happen. And feedback from them underscore that accessibility, agency, and cultural responsiveness must be built into every phase of the research protocol, not just added later, but it has to be a critical component from the design. Uh, their input also help us guide us to the need of redefine traditional research practices by centering communication preferences, safety needs, and autonomy for disabled participants, particularly for those using AAC and from intersecting marginalized identities. A key recommendation from the research assistants was like center accessibility, agency, and equity at every level, from recruitment to findings dissemination. They also talked about AAC users co-leading or facilitating the interviews or the focus groups. They talk about using concise, clear, and multimodal communication systems like text, speech, ASL, or AAC. Another critical component was the sharing questions ahead of time, so the people that communicate diversely have enough time to prepare their responses in different manners and meaningfully participate. They talk also about ensuring voluntary participation at every point. We know from the Belmont report and the IRB protocol that participation is voluntary, but they recommended at several points during interviews and during the focus group to make sure that the researchers or anyone collecting the data, it's clear and repeats that you can pass at any time of any question, and ensure like full transparency about the data, how it's going to be stored, who's going to have access to it, and when will it be destroyed. They also talk about priorities, Black, Brown, and Indigenous AAC lead engagement and mentorship, so that we make sure that the people leading the research are representative of the people being as participants. And they talk about addressing cultural interpretation of AAC symbols, specifically about pacing and the meaning of silence. They also talk about disseminating results in plain language so that everyone can have access and the people can get final understanding of the findings. And a shared agreement, more than inclusive, part of the inclusive protocol was to treat research as a collective good. In this way, we make sure that everyone can benefit from it and that everyone can also participate on it. Okay. When we talk about inclusive protocols, we did this qualitative data collection, and the component was like involved in guiding group discussions, structured around open-ended questions such as, what does this mean to you? What does it look like? What support is? And what are the barriers? This prompt invite participants to share specific examples from their lived experiences and from their mentors or their peers. Our team also adapted the format and facilitation methods to maximize accessibility. We incorporate plain language versions, We make sure to follow flexible pacing, multimodal communication supports like spoken, written, AAC, and real-time captioning. These adjustments helped us to make sure that all participants could engage meaningfully and equitably throughout the 4 sessions. And now we're doing the analysis and integrating the findings. We're doing a qualitative data we're using the qualitative data gathered from the meetings and undergoing a thematic analysis using a coding framework that is informed by disability justice, but also cultural humility principles. These findings, then we're going to integrate them into data interpretation, and we're going to allow qualitative insights to contextualize the findings in the interpretation phase. Sorry, the outcome we hope to produce actionable disability-led evidence on trust, equity, and systems transformation. Overall, the approach that we have followed combines rigor, but also responsiveness, ensuring that the research process is led by most impacted, while also producing actionable evidence in how Lives in Progress Collective, um, um, this project, this program can facilitate trust building, self-determination, and cross systems equity. And how we're gonna disseminate these findings. I'm gonna talk about how boring we're gonna disseminate these findings, right? We're gonna make them publicly, and we're gonna share them with students, researchers, scientists, doctors, professionals, and everyone that is in a position of informing practice. So trying to see that actual change happen. We're also gonna share with advocacy focused organizations and legislators that have in a position of decision making and they can change policy so that they can be used to inform more equitable, more accessible, more inclusive policy development. We're also going to make it available online and in several modalities like plain language, text-based, large prints, audio recorded, ASL, and readable screen readers so that we can also be used to inform access. They're going to be short URLs and QR codes. And now DJ is going to talk about how we're going to disseminate this, but in like a more fun way, more uh, innovative way.
What we know is this: when we're not in words, we offer ourselves new ways of being. When we're in our words, we often can't conceive of a world beyond the status quo. For this reason, our research assistants imagine using a variety of artistic formats to convey our findings. These might include visual art, poetry, and many other forms. These might be on street corners, in hospital lobbies, places where people go to shop, and schools, to name a few. We also want to enliven more traditional ways in which data is conveyed and visualized, such as heat maps, GIFs, dashboards with slicers and other filtering options that are more interactive and dynamic. These modes of dissemination help place the viewer within, rather than distant and removed from, our findings. Next slide, please. We envision doing a multitude of collaborative projects together, including, but not limited to, our systems alignment pilot proposal based in Philadelphia and our statewide proposal to empower people with IDD diagnoses to protect and enhance Medicaid services in rural Georgia. Both projects already have letters of support from 7 to 10 community partners in their respective locations. With LIPC's active connections with local, state, and national organizations and the reach of NLCDB's 19 national partners, scaling up is easy. Please contact us to learn more. We'd like to end by drawing your attention to some of the ways every researcher or presenter can make their presentations more accessible and inviting to all. We used language that spoke to a professional research-focused audience, but will disseminate to everyone a plain language version of what we've said. We added alt text descriptions of our slide deck, simplified our slides, and used visual descriptions whenever necessary. We requested ASL, interpreters, and real-time captioning. But as important, we'd like to emphasize the need to move beyond accessibility by ensuring that those most impacted are asking, and not just answering, the questions that drive every initiative, and are helping us unearth and disrupt residues of ableism and racism attached to common research practices. Finally, we'd like to thank our research assistants and disabled BBI leaders who are making this project their own, SAIH and S4A and the Robert Wood Johnson Foundation, for the funds to jumpstart this project, and our colleagues and fellow grantees at the SAIH Equity Capacity Building Grant, some of whom are with us today.
Hi. Okay, I'm going to hop back on since we're in our Q&A phase of the webinar. Thank you both so much for inviting us into the work that you're doing. Wonderful presentation. I kept writing down questions I thought I could maybe ask, and then you immediately would address it in your presentation. So extremely informative and really, really important work that you're doing. And definitely can see the through line of how folks with lived experience are involved in the research and work that you're doing every step of the way. So I really appreciate that. And DJ, I love the takeaways at the end that you covered. I think everyone loves a tangible kind of takeaway and what they can do or how they can help. And we don't see that often enough. So I appreciated that. I'm gonna ask a dissemination related question. I'm gonna kind of tie two things that you mentioned together. Earlier on in the presentation, you were mentioning that you're still hoping to form more partnerships moving forward with some of the systems partners, so the medical, public health, and social service system partners. And I'm going to tie this into dissemination because I think you kind of touched on that with how you plan to share your findings back with them. And I'm curious, like, what different partnerships you're hoping to form and how you're going to invite them into this dissemination effort so that they can sort of implement some of the findings of your work in their own practices.
Yeah, I can get started with this question. Okay, so yeah, we definitely envision inviting more medical and like social uh, partners. The way we see through dissemination is using relying on the network that the Lives in Progress Collective has already, and some of the our partners at the National Leadership Consortium, and asking not only for like listservs and like social media replies, but also inviting them to webinars that we are thinking like these. We are also asking them to thinking and asking them to come as speakers, thinking on uh, getting some of these actors, social actors, to participate in some of the different kind of activities that we have throughout the program, that we invite people with lived experience, because we have noticed that many professionals within the three systems no often have the opportunity to interact with people with disabilities within these marginalized communities. So that's how from my conversations and our team's conversations with DJ and Lives in Progress, we envision like bringing exposure, and through that exposure, creating more cultural humility, trauma-informed approaches that can bring them in and make the partnership authentic and truthful.
Thank you. I appreciate that response. DJ, did you have anything that you wanted to add? Okay, I'm going to move on to the next question, but before I do so, you're getting lots of love in the Q&A. So some of your fellow equity capacity building grantees are saying, great job. I'm really proud of you. So just wanted to share that. And then there's a question here from Chris Hollis. Is there any way you could include some of this research, perhaps in the future, but with potential audience members like physicians, politicians, etc., to ascertain their attitudes, beliefs about those with disabilities? This information could be combined with the research you're doing now to better frame the information or messages you might be disseminating.
Carrington, there's a comment from DJ. I believe it's about the previous question. I'm happy to read it. It
Sure.
goes,
I know Sadina just put it in the chat as well. I appreciate that. But if you want to read it out loud, I think that would be great.
our systems alignment, DJ says, our system alignment proposal in Philadelphia will bring together professionals and change makers within those systems to learn directly from our BBI disability leaders and to learn experientially as well. Sorry, hard to answer quickly.
No worries at all. I appreciate you taking time to respond to that question. Do we want to go back to the question about including attitudes and beliefs about those with disabilities into part of your research? I can ask the question again if you need me to.
Please.
Okay. Is there any way you could include some of this research, perhaps in the future, but with potential audience members like physicians or politicians, to ascertain their attitudes and beliefs about those with disabilities? This information could be combined with the research you're doing now to better frame the information or messages that you'll be disseminating. Chris also just said, Chris is another equity capacity building grantee. And she said, my question's kind of difficult to answer right away, so I can chat with DJ or Monica offline later. So that's an option. If we don't want to answer that one right now, we can always touch base with Chris offline. Here's DJ. Chris, yes, we mentioned that. We are community-based, locally focused first, and then more nationally based. What we want to do is foreground the voices of those who are so marginalized in multiple communities. Thank you, DJ.
I'd like to add there that there is research from Dr. Carly Freeman, the director of research of CQL, that talks about perspective about people with disabilities, like and how ableist perspective could impact. So we could use that research definitely, and we could that's honestly, that's part of the Chris, that's part of the project that we wanted to do, is to bring together professionals, politicians and physicians all together to learn and participate in create this kind of intervention where they get exposed to what's being like to the experience of people with disabilities. Definitely open to collaborate and yeah, we envision research project in the future, disseminating all this and bringing together the collective.
Thank you, Monica.
Thank you.
I'm going to move to the next question from Al, which is for DJ. What does it mean when you describe yourself as a social entrepreneur? And DJ, as you're answering that question, I'm going to read out another response you had to Chris's question earlier. But DJ also put in the chat, let us hear them first without asking them to share airspace with professionals. Can the professionals listen and experience firsthand and then join us in co-creating change? And also, while we're waiting for a response, Stacy Clinton put into the Q&A that this is not really a question for the webinar, but have you heard about this work, and shared a link? So I'm going to share the link in the chat so everyone can see it.
Thank you so much for sharing that research. We definitely did like a background literature of current projects and current studies that have been conducted. We're gonna like take a closer look on the on this one. Seems like a experiences of ableism in physiatric healthcare, a novel survey report from Nature. It's very good. Thank you. Appreciate it.
We'll also share that maybe in the follow-up email so everyone else has access to it. You don't have to worry about saving it from the Zoom chat. And DJ, thank you for your response to that question about social entrepreneur. So DJ said, what matters is connecting people rather than building more businesses. I'm all about transforming the way we relate to each other as part of an ecosystem. I think that's beautifully said.
Mm-hmm.
I don't see any other questions that have come into the chat, other than just some additional comments about how wonderful the presentation was. Some love from Earl Sims. Super proud of you and the team. And this is an example. I'm going to end with this question, but this is an example of me writing down a question and then the next slide immediately addressed it. So my question was, if there was one thing you want people to leave with today, or one thing that people could do to continue supporting your work, or sort of like one question you want people to continue thinking about, what would you leave them with? I think that your tangible takeaways sort of address that. And so I'm wondering if maybe you have advice on how people can follow along with the work that you're doing and support from afar. And as you're thinking about that, I'm going to read DJ's additional response to the last question. So DJ said, if we just include new groups of people, but use the dominant culture's notions and structures of power, we just reinforce the status quo. Which to me, I feel like that answer is also an answer to my question of what do you want people to leave with today? But DJ also shared, we're here, we're working hard, and we're eager to hear from you. So here's DJ's last comment, and I'll leave that in the chat. That's a way that you can connect with DJ and continue to support the work that this team is doing. And stay up to date on what they're learning. So I know it is time, and I want to be respectful of everyone's schedules. Thank you so much again for joining today and listening to this team and what they're working on. It's very, very important work. And thank you to Monica and DJ on presenting. We really enjoyed
Thank
hearing.
you.
I hope everyone has a wonderful rest of their day.